So we're just going to wait a few more minutes for people to trickle in.
Okay.
All right, so I'm going to start. Hello, everyone. My name is Rishika Voruganti. I am a second-year undergraduate student here at UCLA, and I will be your moderator for today's COVID-19 panel. We deeply appreciate the time and energy you are dedicating to service on our virtual UCLA Volunteer Day presented by the Westcom Foundation. During these unprecedented times, service orgs and leaders across campus have come together to create a day dedicated to volunteerism and promoting long-term sustainable service in a digital age. This year, the UCLA Volunteer Center is partnering with the USAC Community Service Commission, or CSC, and UCLA Student Affairs. So a little bit about these organizations. The UCLA Volunteer Center works to connect students and community members to campus service opportunities through various events throughout the year. The Community Service Commission promotes ethical service on campus and in the community through affiliated student orgs, networking events, and advocacy campaigns. The UCLA Student Affairs is committed to maintaining the welfare of all students and giving back to the local community. With all of that being said, I'm now going to go ahead and introduce our panelist for today. With me is Dr. Samuel Elias, who is currently the medical director at the Ash Center and also the head of our exposure management team. Before we get into questions, we'll begin with the video from our chancellor.
Excited to welcome you to our 12th annual UCLA Volunteer Day. Of course, things are a little different this year. We aren't piling onto buses and fanning out across the city, but I'm so glad we're still coming together in the spirit of public service. The UCLA Volunteer Center, Community Service Commission, Student Affairs, and many other campus partners spent months reimagining this cherished event for our current times. I'm grateful to them, to the Westcom Foundation, and to our community partners for making this virtual day of service and learning happen. And I thank each of you for spending your Saturday with your fellow Bruins. Service is one of our true Bruin values, and it's core to UCLA as a public institution dedicated to the common good. We aim to instill a commitment to service early on through this event, which is a cornerstone experience for our incoming students. Over the years, Volunteer Day has grown to include any and all Bruins from around the world who want to join us in giving back to their communities. This kind of commitment is needed now more than ever, as so many people are struggling with the effects of the pandemic and meeting basic needs. I hope the experiences you have today will be enjoyable and will inspire you to continue volunteering and making a difference into the future. Thank you again and enjoy your session.
Great. Sam, you can go ahead with your introduction.
Oh, is this me now? I'm sorry. Hello, nice to meet you all. My name is Sam Elias. I am the medical director at the Student Health Center, and I'm heading up the exposure management team at UCLA. Sorry about the technical glitches. We're all getting used to the world on Zoom. I've been asked to speak today on how everyone, in the spirit of volunteering, can help to reduce the spread of COVID-19 on campus. And the point that I'm going to come back to for all of you is that I really need all of you to help us to create a culture of caring in our community. What we need is to have everyone around us take responsibility on a personal level for stopping the spread of the virus, and I'm hoping you can help me with that. But let me come back to that in a minute. First of all, I just wanted to give you some basic information on COVID. I'm sure you all know all about this. It's sort of what everyone talks about all the time now. COVID is caused by a virus. And the way that COVID is transmitted is primarily via respiratory droplets. What that means is that if you're within 6 feet of someone who has COVID and they cough or sneeze, droplets from them can get into you and they can get you infected. There is some evidence of airborne spread, which means that the virus can live in the air and that even if you're more than 6 feet away from someone, you can get sick. But although that exists in theory, there are very few cases that have been confirmed on that basis. So it's mostly based on droplets that you get within 6 feet of someone. The symptoms of COVID, as you all know, are completely variable. Up to 30% of all people who get COVID are completely asymptomatic. They never even know they have it. And as we all know, some people that get COVID can get very sick and even die from it. So the spectrum of disease is very, very wide. In people your age, in young people, it tends to be asymptomatic, or it tends to be sort of a cold or a mild flu, fever, cough, body aches. But most people, we have had a number of students get it. No one so far has had serious symptoms from it. What are the best ways to prevent the spread of COVID-19? The most important thing is social distancing, which is why we're all on Zoom today. Because the disease primarily gets spread from people to other people within 6 feet of them, the best thing you can do is limit the number of interactions you have with people within 6 feet. The second thing that really, really does help is wearing masks. If you're wearing a mask and you're contagious, you're less likely to be able to have droplets come out of you and get onto someone near you. That's why we really need you to wear masks. The third thing that you can do to prevent COVID is to wash your hands frequently. If you've come in contact with someone or a surface that has COVID and you take your hands and touch it and then touch your face, you can get infected. So by washing your hands frequently, you can avoid that as well. Let me give you a little update on the number of cases we've had on campus. Currently, we're at approximately 200 student cases and about 100 faculty and staff cases on campus. That's from the beginning of March until now, and it includes people that are not on campus but are affiliated with UCLA. So that includes students who have been as far away as Texas, New York, and even foreign countries. So first of all, what is the campus doing to prevent COVID? Well, the most important thing is that we're offering diagnostic testing, which means that if you have symptoms of COVID, we can get you tested right away. And the testing as of Monday will be completely free to all students, whether they have SHIP or not. So if you contact the Student Health Center, we will test you and there will be no cost. The second thing the campus is doing is we're doing what's called community screening, which means that we're testing people who are asymptomatic for COVID to make sure that there is no COVID in the population. Some of you may have already been tested. We've tested people, undergraduates who live in university-owned apartments. We've tested people who work in those situations. We've tested people in fraternities and sororities, and we will continue to do that. The plan within 2 weeks is that we're going to have community screening available to all members of the UCLA campus on a weekly basis. The next thing that we're doing is we're asking each and every one of you to take a survey before you come onto campus. I'm sure you've all been receiving that. The survey basically asks if you're having any symptoms or if you're in isolation or quarantine. And if you are, it says, please don't come to campus today. That's the best way we have to keep people who are contagious off campus. And the last thing we're doing is we're doing what's called contact tracing. What that means is that any student, any individual, any affiliate of UCLA who's known to have COVID, we call them, we figure out when they were contagious, and we figure out who they were exposed to. And we tell those people to please stay in quarantine for up to 2 weeks so that that if they develop the disease, they don't spread it to other people. So those are the things that we're doing as a campus to keep everyone safe. Now, what can you do as volunteers? What we really need you guys to do is to create a culture of caring at UCLA where every single person on campus feels that it's their personal responsibility to stop the spread by social distancing, by wearing face masks, and basically by staying home when you're sick. Here's the thing, people in your age group are not having serious disease when they get COVID. And so there's sort of a tendency to be like, you know, I don't really care if I get COVID or not, because it's just a speed bump. I'm going to get over it and it's going to be fine. The dangerous thing, though, is that if you get COVID, you can give it to somebody who's high risk. You can give it to your parents. You can give it to your grandparents. You could give it to the lady who serves your food in the dining hall who may be immunocompromised. And those people can get sick. And if we overwhelm our hospitals with people that are sick, we're going to have a big problem. So we need all of you to have a culture of compassion. What we need you to do is we need you to be a good role model. When you're out on campus or when you're outside of your home, we need you to wear a face mask. If you come across people who are not wearing a face mask, ask them very politely, hey, would you mind putting on a face mask? It makes me uncomfortable. We need you to socially distance. We understand you can't have zero contacts in your life, but we ask you not to have big parties and large gatherings. We ask you to wash your hands, and we ask you to just contribute to the culture of caring on campus. And that's the best way this year that you can volunteer for your community. Those are my prepared, pre-made speeches. I'm happy to answer any questions you may have. Thank you very much for your time.
Great, thank you so much, Sam, for explaining that. I'm gonna go ahead and ask some questions that I've prepared, and then at the end, we'll take some questions from the audience.
Great.
So my first question is, what is the risk of getting COVID if I go to a gym, a salon, or other indoor business? And how about if I'm just trying to get like my mail or my packages?
So the answer is that there is a low risk of getting COVID from surfaces. The risk becomes much greater if you're within 6 feet of someone. So if you go and get your packages and you're not near anyone, you're probably going to be fine. If you go to the gym and you stay 6 feet away from other people, you're probably going to get fine. If you get your hair done and you're wearing a mask and the person doing your hair is wearing a mask, you're probably going to be fine. But again, the less you can do that, the better. There are no hard and fast rules, but the more you can stay away from 6 feet away from other people, the better you'll be.
That makes sense. Can I get COVID-19 from food products?
There has been no evidence of that happening.
Do you think that in the fall and winter during the cold weather?
You know, that doesn't look to be the case. So far, it has not flared in cold climates. The flu virus does that, which is why everyone thought that maybe COVID would do that. But so far, it does not seem to be weather dependent. Again, this is only 6 months old, so I have no idea what tomorrow will bring. I think the risk is that when the weather gets cold, people are going to be inside where they're more likely to be around other people as opposed to being outside where there's a breeze. But I don't think the temperature itself actually does much.
Is it true that the virus doesn't survive well in like warmer weather?
That, in theory, that is what's happened, but the virus has taken hold in a lot of hot weather climates. Right now, right now, India is the biggest source of COVID, and India is a very hot place. So it doesn't seem to be that simple that hot weather knocks it out.
Okay. What do you see as a timeline being for a vaccine coming out and life just getting back to normal?
I wish I knew the answer to this. Everyone's best guess is that there will not be widespread dissemination of a vaccine until at least March and maybe somewhere next summer. So I'm kind of hoping that we're going to be looking at the normal world next fall. But we could get lucky, and maybe if the vaccine works, we'll be there sooner. But I think next fall is where I'm trying to temper my own expectations.
Would you happen to know when a COVID-19 vaccine would be approved for distribution?
I wish I had the answer to that.
Mhm.
From what I read and from what I've heard, there will be vaccines approved by the end of the calendar year. The big issue is going to be making and distributing the vaccines. And I don't know where we're going to be in terms of student health. I don't know where in line we're going to be, because I would imagine that people who are at risk would get the vaccine first, which is going to be older people. And they may put young and healthy students at the back of the line. But again, that's not my decision. We'll have to see.
Okay. And if the vaccine were to come out, how effective would it really be? Would it totally eliminate the chances of getting COVID-19?
So the guesstimates right now are that the vaccine will be between 70 and 80% effective. So what we need to get to is a place of herd immunity, where between 70 to 80% of our population is immune. If you were to have every single person in America get a vaccine that's 70 to 80% effective, then you would be at herd immunity and there would be much less transmission, or to almost no transmission. The problem is that there's a lot of mistrust right now in general because of our overall political climate. And I think a lot of people are not going to take the vaccine. So then you're talking about a situation where we're not going to be at herd immunity even with a vaccine. So I think that's going to be our next challenge, is really once the vaccine comes out, is really encouraging people to get it so that as a group, we can all be immune.
Okay. On a bit of a separate note, how important is the flu shot this year, going along with the pandemic?
I think it's very important because again, what we're going towards as a group is we're trying to keep our healthcare system from being completely overwhelmed. The nightmare scenario, which we saw for a couple of months in New York, is there's no space in hospitals and people have nowhere to get help. The flu, if we have the flu and COVID circulating at the same time, there's a much higher possibility that our healthcare system will be overwhelmed. So I think it's really important that everyone gets the flu vaccine so that at least one of those variables is under control. Ash has the flu vaccine, by the way. It is free for anyone on ship. We are happy to give it to you anytime.
Okay, great. How can I protect my family from catching the illness?
The best way that you can protect your family is by not giving it to them yourself. What we're seeing right now is that college campuses are sort of a new hotspot, because 18-year-olds know that they're not going to be having a bad time with COVID, so they're gathering and then they're bringing it back to their families. The best thing you can do is not to get it in the first place and then not to bring it to your family. That's the best thing you can do.
Okay. So, like, say I get COVID-19, what's the difference between like putting myself in quarantine or isolation? Are those two the same
Okay.
thing?
Nope. Isolation is what you do when you're sick. So if you get COVID-19, you need to stay in isolation for at least 10 days. Quarantine is if you're not sick, if you have no symptoms, but you've been exposed. So what we're telling people is that if they've been exposed, they need to stay in quarantine for 14 days. And that's because it can take up to 14 days after an exposure to develop the symptoms of the disease. So isolation is for sick people, quarantine is for healthy people.
And then this is just the personal question I had. So after you develop the antibodies for COVID-19, does that ensure that you're like immune forever, or is there just like a short period of immunity?
Well, there's the answer is we think. So I'm giving you all the we thinks because we're still at the beginning of this. We think that you would be immune from that strain of COVID-19 for the rest of your life. The issue the question is whether the virus mutates. It's possible that the virus will change over time and that you wouldn't be immune to the new strain. So far, we have seen different strains, but we've not seen any strains that are not covered by your own natural antibodies. So I'm kind of hopeful at this point that you're not going to really get COVID over and over and over again, but we're not 100% there yet.
Okay. And then I think that is all the questions that we have. If anybody in the audience wants to send a question in the Q&A, I can go ahead and ask.
Rishika, do I see these or do you read them to me?
I'll read them to you.
Okay, thank you.
So, we got one. Are there any volunteer opportunities on campus for people to help?
Yes, the best thing you can do is join the ambassador program. I don't know if you've heard about the ambassador, but there is a program called the COVID-19, the Public Health Ambassadors. It's being run out of Recreation, and it's a group of students who have been trained in ways to help their community be safe. If you're at all interested, please go to the Recreation website and look under Public Health Ambassadors. That would be a great way to help.
I had a question. We were talking about different strains of the virus before. Do we already know if there's new strains currently?
There are two, we do know that there are two strains, but the two strains we think are not, that if you're immune to one, you're immune to the other.
Okay. How can we reach people who don't believe in COVID?
That is a very good question. I wish I had an answer for you. I think what you just need to do is appeal to their sense of the greater good and say, even if you don't believe that COVID is real, in case it is, you might want to take care of everyone else. That's the best thing I could think. What do you think, Rishika?
I think just trying to research as much as you can, like present people with facts and statistics until they believe you is really the best option, but just like objective data.
Mm-hmm.
And I feel like this is a super big question. I'm sure everyone is wondering, how likely do you think it'll be for campus to open this academic year?
I wish I had the answer to that. There are two possibilities for the way this is going to work. Option one is we're going to remain closed the way we are until after the vaccine. Option number two is that because the case count gets really low, we open up slowly and slowly bring people back. I'm hoping that it's going to be option two, and that starting with the winter, we're going to bring back more classes and slowly ramp up. I would say it's about 50-50 at this point. What's really interesting in Los Angeles County is we've never had a huge spike. Like we never did New York. New York had like 1 million cases and then dropped. LA has been very stable. It's been sort of the same numbers over and over and over. I really don't know why that is, but hopefully the cases will start to drop and we'll be allowed to slowly open the campus.
Okay. And what do you think campus will look like if we all do go back? Do you think everyone's still going to be wearing masks? We're going to like sit in big lecture halls? What will life be like?
I think that we're all going to be wearing masks and 6 feet apart until after the vaccine. So what I'm hoping is that we slowly reopen campus and have more and more classes, but those classes, I think you're going to be 6 feet apart and you're going to be wearing a mask in your class until after the vaccine.
Okay.
And I just have to say, this sucks for everybody, but it especially sucks for you guys. I mean, college is so short and you've sort of had this chunk of your college career where it's so abnormal. And I do feel for you. I really do. It's not anything anyone wants. I get it.
Knowing that it is easy to spread and spike, would it be ethical or responsible to open, I'm guessing, like open school? And would the best choice be to wait until after the vaccine?
Again, that depends on the data. So if Los Angeles County manages to keep the numbers down, I think it would be ethical to open slowly. Right now, we're not there. The Los Angeles numbers are still fairly constant. If they were to drop, which I'm hoping they're going to, then I think it would be responsible. But we're only going to do it in an ethical way if the numbers allow us to.
Okay. Anyone else has questions? Even if we already repeated something, feel free to ask. It's just so insane. Like,
It is totally insane.
life was normal, and then in 1 week, it just wasn't anymore.
Yep, I feel like we all had two lives. We had a life before March, and now we have a life after March, and they're completely different lives. We're all living we just went to a different place. My
Mhm.
job has certainly changed 100%. My job is a completely different job than it was last year.
Yeah, definitely. Would you avoid dining in at all costs, or do you think it could be safe?
Um, I think that I think that I would be nervous to dine in at a restaurant in the general public. However, on campus, we've sort of created bubbles where people who live on campus and the people who work on campus are being tested on a regular basis. I think in that situation, I would feel comfortable dining in, but I don't quite feel comfortable yet going to a restaurant. That makes me a little bit nervous because I don't think that there's any way that the people around me have been tested.
Do you think that it's safe right now for restaurants to open with like open dining outside?
I think it's a little bit right on the edge.
Okay.
I think it's right in between safe and unsafe. It's right in that in-between zone.
Definitely. Is COVID-19 testing free for all UCLA students at the Ash Center?
Starting Monday, yes. What it has been up until now, because of for insurance purposes, is that if you had symptoms, your testing was covered, but if you did not have symptoms, your testing was not covered. That the university has decided that that's not a good method of pandemic management. So the university is going to be chipping in starting on Monday so that anyone who wants to get tested at ASH can do so for free. But again, we're also rolling out this once a week surveillance testing. So all of you probably are going to be invited to do surveillance testing, which means asymptomatic testing within a couple of weeks. So you're probably not going to need to really come to ASH to get tested. You're probably going to go to a site in Ackerman or in Covell or somewhere and be able to just self-collect your own swab. But that's a long story. Bottom line is it's free on Monday. Starting Monday, it's all free.
How fast do you think people will get their results after they've gotten tested?
Okay, so that has been a problem, and I know that it's been a problem. The problem that we've had is that the demand for COVID tests is far outstripping the supply of laboratories that can chug out the tests. We're very lucky that if someone is sick and has symptoms, we send that sample to the medical center and they do it within 24 hours. We're very lucky because that has not been the case in much of the world. However, the asymptomatic testing that we're doing, the test results can take up to 2, 3, sometimes 4 days. We think at this point we have it down to 2 days, but it's sort of a moving target. So I would say your expectations, if you have an asymptomatic test at one of our surveillance community screening sites, I think your expectation should be 2 to 3 days.
Okay.
But we're desperately trying to get it as short as we possibly can. It's a bigger problem than us. There's just the tests, the capacity for testing is just not there in the whole country, in the whole world.
Yeah, it's really nice to hear that you guys are like working with us to try to get a short result time because
We are, and I know that it's caused so many problems, and I know that also when there's a long time for the test result, it sort of makes the test useless. You know, you're like, it sort of makes the whole thing a worthless experience. We get that. We're desperately trying. The medical center just came up with just got emergency authorization for a new COVID test just last week. So we're desperately trying to roll that out, and that's the platform that we're going to be using, hopefully, to test everybody on a regular basis. It's an amazing technology. They actually have a lab that's completely robotic. So you give your sample in, it goes into this thing, and robots do everything, and they get you a result hopefully within 12 hours. That's what we're working towards.
Okay. And how often can students who are asymptomatic get tested?
We're going to be testing every week. I would think that's our goal, is to do it every week. And the goal of that is to really contain an outbreak. If we wanted to prevent all COVID, we'd really need to be testing maybe every 3 days. But again, there is just not capacity to that. By doing it every week, we think that if someone has COVID, we can take them out of circulation before they infect a lot of other people. So the goal of our program is to prevent outbreaks. And I think every week is a reasonable, every week at this point is where we'd like to be.
Okay.
With the idea that maybe when there's more capacity, we can go even sooner.
Mm-hmm. And can you really like detail how that whole process will be between like, do I have to make an appointment to get a test? Do I just walk in? How does that work?
So first of all, this is all a work in progress. We don't want to have it be on a walk-in basis because then people are going to crowd, and we want people to spread out because we don't want you getting COVID while you're waiting in line to give in your COVID test. That would sort of defeat the whole purpose of the whole thing. So we're definitely going to have you make an appointment. What we'll be doing is putting out a link that you'll be able to go onto this site and book your test. And what we're hoping is that you'll book for a whole semester. You're going to say, like, based on my class schedule and based on my life, Tuesday at 11 o'clock is the perfect time for me to get tested. And then you're going to go every Tuesday at 11 o'clock to the site, either in Ackerman or Covell or wherever, and give your test in. So it'll be definitely timed, definitely scheduled, and there will be a link that you'll be able to follow to do it.
Okay.
But again, we're making this all up. We're working on this as we speak.
And as of right now, is that testing only for the students living on campus or all UCLA students?
For right now, it's students living on campus or in university-owned housing, but our goal is to make it for all students regardless of where they live within a couple of weeks. So if you live in an off-campus apartment in Culver City, you can get tested. Another plan we're trying to work on is to have a van that drives around so that people who live off campus don't even have to come on campus. They can go to the van and give a sample in at the van. Again, this is all in the works. But
Okay.
the van would go to, off campus sites. Maybe not as far as Culver City, but Westwood.
Yes. Is this all like just talking, or are there like actual movements towards
It's not just talking. I realize we're not there yet, but we're desperately hard working on this. It's seriously challenging, but it's not just talk.
Okay, that's
not
really
just
good to hear. Has there been any changes in which method of testing is the most reliable, and has the mouth swab test improved?
The best test right now is still the nasal swab where you stick the Q-tip up your nose. The lab at UCLA that got emergency authorization use has come up with a saliva test, so that instead of having to stick the Q-tip up your nose, you can spit in a test tube. That we think is going to be almost just as good, within a couple of percentage points, just as good as the Q-tip one,
Okay.
as the nasal one.
What do you suggest we should do before we fly? Like, what precautions should we take?
I think the best thing that you can do if you have to fly is just to make sure that you're wearing a face mask while you're flying. And I think that's pretty much everybody does that at this point anyway. I haven't been on a plane since March, but I can't imagine anybody's walking on a plane without a face mask at this point. But the best thing to do is just really to wear a face mask when you fly.
Yeah, I actually remember when I was flying back from campus, it was like half the people were wearing masks and half people just weren't doing anything.
Seriously?
Yeah.
That's terrible. But that's part of our culture of caring. We need to get everybody involved in caring so that everybody cares. Even if they don't believe it, they'll go, you know what? In case it would get my grandmother sick, I care because I care about my grandmother.
That's good. I mean, the whole thing is just being a good person to others at the end of the day. How soon will we have an effective vaccine? I feel like we touched on this before, but
and I just real quick again, I'm hoping that we have an approved vaccine before Christmas, and then I'm hoping that it gets widely distributed by March, April, May. That's what our hopes are at this point.
How often are non-medical UCLA staff working on campus, and should they get tested for COVID?
they're going to be rolled into this. Okay, first of all, the staff who work in university housing and in university dining halls are being tested right now. They're being tested once a week. We're hoping within a couple of weeks to expand that so that all essential employees are tested once a week and everybody involved in research is tested once a week. So basically, we're hoping to test the entire community once a week. That's our goal.
Great. How can we debunk rumors that our family members start to believe about COVID?
I wish I had an answer for you. I think the first thing we need to do is vote in November. That would be step one, would be for all of you to vote. We unfortunately live in a time where certain aspects, people in our society have decided to actively question science and logic. And I don't really have an answer for that, except to try to be compassionate and listen, but just try to give them the facts.
Mm-hmm. And again, like we talked about this before, but you can't like forcibly convince anyone anything. All you can do is just like be respectful and say the things that you know and just like hope they understand. And let's see. So if we have to go to the hospital or ER for other reasons during this time, what would responsible behavior look like afterwards? Is a hospital safe or would you still consider it a hotspot?
So, you know what's very interesting is at the very beginning of the pandemic, there were a bunch of hospital employees that got sick. And I think what happened was nobody knew what protective equipment they should be wearing. So at the very beginning, there were a whole bunch of cases at the hospital, and there was a big worry that, oh my God, all of our nurses are going to get taken out. What are we going to do? That stopped. And I think what happened is basically, if you go to the hospital right now, every single person you interact with is in a face mask. Nobody if I've been to the hospital a million times, it's like weird because you only see people's eyes. You have no idea what anybody looks like except for their eyes at the hospital, but it's worked. There has not been spread within the hospital. This is also true at the dental school. The dental clinics have been open since like April or May. There have not been any cases. There have to have been patients that had COVID that were seen at the dental school, but no dentists, no dental students, no dental hygienists have gotten it. So I think what that really speaks to is that the personal protective equipment that we're giving people is working. So if you need to go to the hospital, God forbid, if you need to go to the ER, I don't think you need to be freaked out that you're going to get COVID. I think you just need to be respectful and wear a mask. But luckily, our healthcare system has not been a source of transmission.
Okay, that's good. So let's say that campus reopens, but people are still unsure about how safe it is. Do you think UCLA is going to make in-person classes more of an opt-in, opt-out process, or like what's
you are completely beyond me. But I have a feeling that my guess would be that before that until there's a vaccine that's widely disseminated, I don't think anybody's going to be required to do in-person classes unless they are in the healthcare field. That's really basically the people that are taking in-person classes right now is med school, nursing school, dental school. That's who's in person, and a couple of other people. I can't imagine that's going to change until we have widespread vaccination or widespread herd immunity of some sort.
Yeah. Okay. If students have already had COVID, do they still need to be tested regularly?
Our thinking right now is that there's no reason to get tested for 3 months. So if you've had COVID, we don't need to see you and test you again for 3 months. I'm hoping that that becomes permanent, but right now we're going with 3 months just because the data is all still new. But if you're out there and you've had COVID and you get the message on your phone saying you need to go in for weekly surveillance, you can ignore that for the next 3 months.
Okay. And so people won't be like penalized or anything if they ignore that.
So there will not be penalized. Again, we're creating these whole databases to keep track of this. So there may be a phase where you get an email saying you haven't come for your testing, where are you? But there will be a way for you to get off the list. Again, we're still creating this whole thing. But no one's going to be, if you've had COVID and can show me the result that you've had COVID, you are not going to get in trouble because you didn't do your testing for 3 months. I promise you.
Okay. And someone had a follow-up question on that. What is the reason for like that 3-month time where you can just bypass the test?
That's because the CDC guidelines right now are that they have done tests and they know that people are immune for 3 months. As time goes on, they'll know that people are immune for 6 months, 9 months, 12 months, and hopefully we'll expand that. Right now, we only have 3 months of data, which is why we came up with the 3 months.
This is like so good to hear. I feel like everyone is just getting so much information from a bunch of different sources. We really don't know like what's true and what isn't.
Well, and again, we're all learning it as we go along, but that's the logic. The logic behind it right now is that there's 3 months of data that you're not getting it again. That's why we came up with 3 months.
Okay. How risky is it to take public transit right now? And aside from wearing a mask, what other measures can be taken to protect someone in this situation?
I think that if you're wearing a proper face mask and if you're not crowded right up against someone on the bus, I think you're okay. And again, it's the mask is really everything for right now.
And
interestingly enough, in New York, they did not have outbreaks from the subway. That was everybody's fear, is that, oh my God, one person on a subway. And for some reason, that didn't seem to happen. But again, I don't know why. That's only an observation without a why behind it.
Okay, so you know about like the Black Plague and how everyone discovered that the cure for that was just like showering?
Mm-hmm.
I wonder if it's going to be something similar for this.
We shall see.
We'll see. Okay. How reliable are the test results and what are the chances of a false positive?
Okay, so the PCR test that we do right now, where you stick the Q-tip up your nose, have approximately a 96%. They're 96% sensitive and specific, which means that 96% of the time, if you're positive, it will give you a positive, and if you're negative, it will give you a negative. That's what the tests show. I have to tell you, I think it's probably in real life a little bit lower than that, because we've had a number of cases where people have gotten tested multiple days and gotten discordant tests on multiple days. I'm going to guess that it's really more about 90%. So I think you can trust get your results about 90% of the time, which means that 10% of the time you can't trust it. I get it, but it's the best we have.
So say I take a test, it comes back positive, but I'm like, I haven't seen anyone, I like haven't done anything, I'm pretty sure it's wrong. How would I go about getting another test?
Well, here's the thing. Even though I'm fully admitting that there's a chance that that is a false positive test, I think you need to go into isolation for 10 days. Unless you've been in isolation for 10 days and you know that there is zero possible way, I think the safest thing to do to create a culture of caring is for you to be out of commission for 10 days. And having a repeated test is not going to change that. So if you have a positive test on day 1 and you go on and we've had people do this, you get a positive test on day 1 and then on day 2 and day 3 and day 4, you get repeat tests and they're all negative. We don't know if that's because the first test was wrong or because you're clearing the infection and that's why your repeat tests are negative. So we're going to tell you to stay in isolation for 10 days either way. And the repeat tests are really just they're sort of not helping the situation.
Okay. So I think this is a concern that is just super prevalent. It's just really frustrating to see our friends and peers being so careless with socializing. Like, especially it's college culture to just like live it up, have fun. But do you have any advice to approaching our own peers on how to talk about this?
I think you need to appeal to their sense of doing the right thing for the community at large and making sure they understand that their actions affect other people who may be vulnerable. And that's a hard conversation to have, but that's the reality of the situation.
Yeah. What was that statistic you said for how many UCLA students
I
have gone?
think we're at right about 195 or to 200. I can look that up in a second, but we're right about that.
Is that like pretty good?
Well,
compared
I think it's, look, there are 40,000 UCLA students
Mhm.
and we have 200 cases. I mean, that's really low. On one hand, it's good that it's low. On the other hand, I kind of wish it was 39,000 and we were all done with this, you know? So, but it does speak to the fact that I think by and large, you guys have been doing a great job.
Mhm.
You guys have really been doing a great job.
Good job, guys.
Good job.
So
Yeah.
good to hear. So someone is currently planning a memorial for their mother. What is the safest way to do this while also having that in-person aspect?
I think the answer is to limit the number of people that are at the in-person memorial, and to have everybody at the memorial try to be 6 feet away from each other and to wear masks, which I know is completely inconsistent with having a memorial. I get it. This is maybe oversharing. My mother passed away in March and I wasn't able to go to the funeral. You know, so I get it. I get it. It's really, I never thought I'd miss my mother's funeral in a million years. I can't believe I didn't go to my mother's funeral, but nobody, my whole family didn't go. We had a Zoom call instead, you know, and that's just the reality of life in 2020, in 2020.
Mhm. I'm so sorry to hear that. And I'm also
That's,
sorry for
that's quite
personal
okay.
situation.
She was 94. She had a great life. It's good.
Good to hear.
Yeah.
And then someone said, but isn't that misleading? This is to our 200 number before, because not all 40,000 of us are on campus. Like, how is
Yeah.
it?
Oh, I'm sure that the 200 number is lower than the real number. I'm sure there are people who are not on campus that never reported to me, student health, that they were sick. I'm sure. So, but that's the best. That's the best number I have. That's the only data I have. I'm sure it's too low, but if you triple it, you're only at 600 out of 40,000. You know, so it's because it's such a low number. It's really good.
So how would you compare this number of 200 to those who are actually on campus right now?
Well, right now we have the housing people can correct me if I'm wrong. Right now we have only living on the Hill, we have about 750 people. We have very few people on the Hill. And then we have another couple of thousand in university owned apartments. So, but again, they just moved in a couple of weeks ago. So I'm sorry, I think I don't quite get the question. I don't think I'm answering your question because I don't think I'm getting it.
I think it's like comparatively, like the ratio of those infected to those on campus.
Well, I think the ratio of total infected to those on campus is sort of not a great statistic, because what would matter is what the issue would be if we were to start, if we in December, if we created the statistic of how many people were infected who lived on campus versus the number on campus, that data point would be a relevant data point. I just don't have it yet. So far, since people have moved back to campus, we have not seen a huge uptick. We've been getting approximately 1 to 3 student cases a day since May, and that has not changed since people have moved back onto the Hill. It didn't. I was worried that, you know, people would move into housing and all of a sudden I'd be having 5, 10 cases a day. So far, knock wood, that has not happened. So far it's not spiked.
I know at UNC Chapel Hill, they opened for 1 week and then they had like 100 cases.
Right.
So it's good that we don't have that.
No, but a lot of even local institutions like Cal State Long Beach had hundreds of cases. San Diego State University, I think, had almost 1,000. So it's happened everywhere.
Okay.
But again, I think you guys are smarter. You guys are doing better than everybody else. I really honestly believe that.
And if a student had COVID, let's say like over the summer, and now they're living in off-campus housing, do they need to report that to UCLA?
We would like them to report it because it helps us get our statistics. Like, so we want you all, if you live off campus and let's say you go to an urgent care and get tested and you're positive, we'd really like it if you let us know, if you call the Ash Center COVID hotline or just send a message to your provider, because that way it can help us keep our statistics up to date and we can contact trace you and make sure that anybody you are around gets informed without you having to do the dirty work yourself. So if you live off campus and you test outside of Ash, which you're not going to have to do anymore because it's free at Ash, but if you do get tested outside of Ash, please do let us know. That's really helpful for us to know.
And you said that the free testing is only for on-campus residents, correct?
No, it's for all students.
All students.
If you're a UCLA student and you want to get tested Monday morning, it is free.
Okay.
Period.
Good to clarify.
Yes.
And then someone said, what are normal numbers for campus housing?
Oh
Like
boy, I bet I'm going to totally bungle this, so I apologize if I do, but I think we normally have like 15,000 people living on the Hill. And right now we have like 750. So that's,
whoa.
It's really low.
Yeah.
And just so you know, the argument has been made that it's safer to have people in on-campus housing rather than have them crowd into campuses off campus. And we have discussed this with the public health department 1,000 times, that are we doing a disservice by closing the dorms and making everybody move into Westwood? And there's a lot of different opinions and nobody has the answer. But
what is your opinion on that?
I kind of honestly think it might be safer to have populated the dorms a little bit more. I think the dorms are a much safer environment, a much safer, more regulated environment than off-campus housing. And if I ran the world, I probably would have let housing had more people in it. But there's pros and cons, and I'm just giving you an opinion. I am not speaking for UCLA administration.
Of course. And I think I agree with you. I know so many people who didn't get housing contracts, but just got like apartments instead.
Right,
so
and they're living with like 6 people in a 2-bedroom apartment, which is like a disaster. Oh, let me mention one other thing. If you live off campus and you get COVID, or if you get in quarantine because you're exposed to someone with COVID, we can take you on campus into housing. There is isolation and quarantine housing on campus for anybody who needs it. So if you're living in a situation where you have 6 people sharing a bathroom and one of you gets COVID, they can move on to campus so that everybody else doesn't get sick. So if you can call the Ash Center, let them know you're positive, and we will facilitate the whole process for you.
Is that all like free of charge, or is that
Yes, I'm pretty sure it is.
Okay. And someone said, can you explain contact tracing?
So contact tracing is every time we have a team of people who are all working remotely. Every day we get lists of people who've tested positive. We reach out to the person who tested positive and make sure they know that they need to stay out of circulation for a certain period of time. And 2, we find out who they were exposed to while they were contagious. We contact those people and tell them that they need to go into quarantine. So it's really a way of trying to take people out of circulation who have the disease so that they don't spread it. Another thing you can help with is some individuals, and this is nationwide, have been very resistant to the idea of contact tracing. They feel like they're narking out their friends and they're narking out their family and that they're violating their privacy. And I get it that it's sort of weird, but it really helps us contain the spread of disease when people comply with contact tracing. So another thing that you can do as volunteers is to encourage people to comply with the contact tracers and really help them have the information they need. And just so you know, when someone is called and said, you need to be in quarantine because you were exposed, we never tell them who they were exposed by. So we never say, hey, John Smith was sick and he coughed on you. We just say, somebody was sick and they were near you, so you need to go into quarantine. That's part of our protocol.
Okay. And for the emergency isolation that we were talking about earlier, is that only applicable to those living in university apartments or neighboring cities in and around?
No, it's all students anywhere. So if you live in wherever you live and you need to come onto campus, you can come onto campus.
So,
and I know there was a question about whether I don't think that we have the availability to house staff and faculty at this point. So if someone who worked on campus and couldn't quarantine, we have resources for them, but I don't know that we can house them ourselves at this point.
Okay, so say I am living in an apartment with one other person, but they don't go to UCLA and they get COVID.
Right.
Would I be able to go into isolation?
Yeah,
Okay.
you could come into quarantine because whatever, the word is quarantine because you're not sick, but
Yeah.
you could come, and especially if, so here's the thing, if you live with somebody and you have a 2-bedroom, 2-bathroom, you probably don't need to. But if you have a 1-bathroom and you're sharing it with somebody with COVID, yeah, come onto campus, please.
Okay.
Please.
And those resources will be given to me if I contact who?
I honestly think the best way, the housing people, it runs through housing. You can certainly access it through ASH. I have to leave it if the housing people have a direct number you can call, but it's been done through the contact tracers so far. So when the contact tracers reach out to people, they arrange the whole thing. But if you're off campus, all you need to do is write a message to your provider at ASH or call the ASH COVID call center, and we will set you up. That's totally why we're here.
And so we have like a few more minutes. If anyone else has some last minute questions, we can go ahead and answer. But yeah, this was great. It definitely answered like a lot of my own concerns I had for going back to campus, which is good. Okay. I don't see any more questions, so I'll just go ahead and go into the closing. Oh wait, actually. Okay, this is gonna be a little scenario one. Imagine you live in a household with 8 people. One of you gets COVID. Can you explain why it does or doesn't spread? One person in my house had it and tested COVID. She hung out at my house for 2 days, but none of us got it. No symptoms or positive results.
Yeah, I wish I had an answer for you on that. It's like any infectious disease. If you have a cold, you pass it on to some of your friends, but not all of them. We don't know exactly why that is. I wish I had an answer for you, but I don't.
All right, well, that wraps up our panel on COVID-19. Thank you to everyone for joining us, and thank you, Dr. Sam Elias, for answering our questions. If anyone has any other concerns, please feel free to email it to volunteer@saonet.ucla.edu. All right, everyone, have a good day.
Bye, thank you. Thanks, Rishika. Am I supposed to stay on or?
I'm just gonna stay on until everyone is out.
I'm happy to. I'm just not sure what's going on.
Hi, Rishika and Dr. Elias.
Oh, hey, hi, Jeffrey.
Well, thank you so much for this amazing panel.
Wait, who's in the UCLA sweatshirt?
My name's Chris.
Hi, Chris.
Hey, great job. Thank you so much.
Sure, thank you.
Of course, sounds great. Okay, so we'll just wait until all the attendees leave, and then we can officially just close this panel for COVID-19. So thank you so much for everybody's participation. We truly appreciate you for joining us today.
Bye. See you guys.
Thank you.
Thanks, Sam.
Bye, Josh. Talk to you later.
Sir, thank you.